I'm going to demonstrate some gua sha on different areas of the body just to show how the technique works on perhaps the extremities. So here I'll show the elbow, and with the elbow and, for example, also with knees and fingers, you can use smaller and thinner gua sha tools. These are appropriate here because they kind of fit into these smaller spaces a little bit better. So for this particular demonstration, I will use like this shark-shaped tool because it holds in the hand easier and I can really get it into the elbow. And because this area of the body doesn't necessarily have a lot of flesh on it, it's okay to use the thinner and the smaller tool. So when it comes to using the extremity, remember, so if the client is complaining of elbow pain, so we're going to go at the area as well as above and below. And you want to hold and support the skin with the opposite hand. So we have a nice target here to work with. It's nice and the skin is nice and taut. And then using your technique, 45-degree angle. Now we're working with down. Remember, we're always going down, unidirectional, closely timed press stroke in the area. So, this area doesn't have a lot of flesh. So always check in with your client, let them know that they can stop or have a break at any moment. This can sometimes feel a little intense, and this can be kind of a nervy area of the body. So we're working until we start to see some of that redness show up. The model here says that he doesn't necessarily have a lot of elbow pain, so I'm not necessarily expecting that we will see a whole lot in the area. But we're getting this nice pinkness to the area. We can see it kind of extends below. So we'll work just a little bit above the area. And then now start to drag it through a little bit below. And again, my strokes here are about 6 inches long and working at anywhere from like a 6 to 7 on a scale of 10 for pressure. So I've gone over this area several times, probably about 20 plus times, and we're not getting any more sha or any more redness in the area, just a little bit than what we have here. And that kind of comports. The model was not complaining of pain here, but just to show you the technique in the smaller space and in the smaller area. We can also work in the bigger muscles of the elbow. However, most elbow pain is usually going to originate from here at the olecranon. So I like to start here first, and then we can also work with the muscles in here in the forearm. And now we're starting to get a little bit more of the sha. I will say that when it comes to elbow pain, if the elbow pain is here on this medial side of the elbow, you want to be really careful applying gua sha here because the radial nerve goes right under this area, and this can be really uncomfortable for your client. So you may want to just work around the area and try to exhaust everything around the area. And then if your client is still having some elbow pain and you still think that there's some sha that can be brought up, you just work kind of really delicately here over this radial nerve, or else you're going to cause like some pain for the client, and that's not going to be very pleasant for them in their arm. When it comes to using gua sha on the extremities, like the hands or the feet, the musculature of the hands and feet are a little bit different than anywhere else in the body. The main musculature exists between the metacarpals and the metatarsals. So you may not see a lot of sha. That's just kind of the nature of the anatomy of the extremities. However, gua sha can still be appropriately used in these parts of the body. Again, we have started with our chi field area, and then now we're working along the course of the muscle. So you would take, a smaller gua sha tool, just like what we were using on the elbow, something that's thin and fits into the space here, and you're just going down the area. It's not going to be comfortable for your client if you continue to go over the joint all in one stroke. So I like to go like up to the joint, and then you can work in really small sections. And this way my tool is I have a little bit more shallow angle. The tool's pretty flat here, maybe like 20 to 30 degree angle. And then you'd follow it again down the hand. So you're always supporting with your opposite hand, keeping everything under your control. The strokes will be a lot smaller here, but we're working down and through. And just because the way the musculature is here, you're unlikely to really produce like a lot of sha, but you will get the ecchymosis, you will get the redness in the area, which means that you are having a successful treatment.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.